Turn the love up a little bit louder. Rep the king just a little bit prouder. Putting hope on the radio. See why? Gonna let them know it's the inspirational power hour.
You are listening to the Inspirational Power Hour podcast with your host, Chandra Wise. Now, generally on this show, we are talking about all things gospel music, but this week we're doing something just a little different. We are talking about mental health awareness. Now, May is Mental Health Awareness Month, and this is a conversation that we are committed to have, and we have another episode coming up in the next week with Mrs. Rhonda Davis. But today, I am talking to Dr. Justin Turner. Justin is a physician right here in the Jackson, Mississippi area. He's also a good friend, and I was incredibly excited some months ago to sit down and have a conversation with him about mental health awareness. And it was such a great conversation that I wanted to share it with you guys. All right, so as always, make sure that you're following online on Instagram and Twitter. Make sure to follow at Chandra Wise. On Facebook, make sure to like the Inspirational Power Hour fan page. All right, guys, let's get right into my conversation with Dr. Justin Turner.
It's the Inspirational Power Hour.
As many of you might know or might not know, May is Mental Health Awareness Month. And so I'm really, really excited for us to be able to have this conversation. And I have a good friend of mine in the studio with me, talking to none other than Dr. Justin Turner. How are you, sir?
Hello. Doing great. Good to see you today.
Listen, I'm really glad to have you back, especially for an important conversation such as this.
Yes, ma'am.
So now, Justin, for many people that may not know, you are, you give me your
internal medicine physician.
Internal medicine physician.
Yes, here in Jackson, Mississippi.
With your own successful practice.
Yes, God has blessed me to be able to own my own practice called Turner Care. It's in South Jackson off Highway 18 over at 2135 Henry Hill Drive.
That's right. And so really successful practice. We were just kind of talking about your expansion and growth that we're praying for.
Yes, ma'am.
So I would love to refer people to you. I just don't know if you can take them right now, Justin.
I really can't, but technically we are still taking new patients at this moment.
Okay.
I will give everyone a heads up and let you know that we have about a 3-month waiting time as far as getting new patients in.
Yeah.
However, we do have a waiting list. So if you call and ask about being placed on a waiting list, understand that sometimes things come up, patients have to reschedule.
Yeah.
And a lot of times we're able to get patients in sooner than that 3-month time.
Yeah. All right, guys, but today we're here talking about mental health awareness, okay? Now, Justin, not specifically your area of expertise, but it's one that you're very passionate about. It's something that you definitely have some experience in with dealing with patients and touching on those issues. And just a conversation that you and I, something we've been conversing about for a few months now.
For some time now,
actually.
Yes,
just kind of talk to me a little bit about why you're so passionate about this topic and conversation.
Awesome. So at the age of 12 was when I first realized that I wanted to be a physician. Mm-hmm. And the reason I had that epiphany was because being a physician awarded me the opportunity to help. Right. And it sounds cliche when you hear a doctor say, I want to be a doctor because I want to help. But I really, really do have a passion for helping people. Mm-hmm. So I realized being a doctor would allow me to do so. And I always, during my time of trying to figure out what type of doctor, I wanted to be a general doctor because I wanted to be able to help everybody. Mm-hmm. I wanted to be able to help with all issues. Mm-hmm. So when I was in medical school and learning about all these different specialties, you could be an OBGYN, you could be a family medicine doctor, you can be a cardiologist. I always wanted to stay general, but I never really thought about psychiatry. Mm. But I finished medical school, came back to Mississippi to do my residency over at University of Mississippi Medical Center, and we had a chance to see a lot of patients there. And I was realizing that a lot of the patients had hypertension, they had diabetes, they had heart disease, and all these other things that Mississippi leads the nation in. But those things could not be addressed until the underlying behavioral health issues could be addressed. And those things just were not discussed. It was not popular. Patients didn't want to talk about it. So as I got older and had more experience, I realized that a lot of that was taboo, especially in our community.
Absolutely.
So with time, I eventually finished my residency and started my own practice. I took a 2-year job working for a corporation. And at that particular time, I realized I was not able to give those patients the same quality of care that I felt like at age 12 that I felt like I wanted to do. I was kind of forced to see patients every 8 minutes or so, and they wanted me to meet a certain quota. So November 2013, I started my own practice with an intentional effort to make sure that I spent enough time with patients, because the hypertension and the diabetes and the heart disease, that's actually fairly easy to treat. But it's the depression, it's the anxiety, it's the post-traumatic stress disorder that holds us back. It holds a lot of patients back from being able to get the blood pressure and diabetes taken care of. So I'm passionate about it because I can't help the regular conditions, if you want to call those regular conditions, because there's so many other barriers psychologically, mentally, emotionally, spiritually, that's affecting patients.
Absolutely.
You know, God gave me a vision when I asked him before I got my own practice. I said, Lord, tell me what you want me to do, because I understand that if it's not in his will, that it's not going to work.
Right.
And God doesn't always speak very, very clear to me, Chandra. But I promise you, I heard this clear as day. He told me, he said, Justin, I need you to treat the whole person, mind, body, spirit, and soul. So for the last 6 years, we've done that. We've taken that approach. Oh my God, it's been amazing. The amount of patients who have gotten better, who struggled with high blood pressure for years, who struggled with diabetes for years, and now they're off insulin. Now they're losing 20 pounds, and instead of having to have surgery for the knee pain and costing $20,000, now the knee pain is gone.
Right.
Just with fixing the underlying problem. So I'm passionate about it because I realize that the whole person is an area where patients have been neglected for so long, and now that we're doing it, oh, it's just a blessing.
And you've been very intentional about that. Through, I've watched you all these years, and I've seen the intentionality in the way you've approached your practice and your patients and the care and all of that. And
Thank
so I believe that it's no just happenstance that your business has grown the way it has. You can call it a business, you can call it a ministry, especially the way you approach it. And I've always appreciated you about that.
Yes, ma'am.
And so as we talk a little bit more about mental health awareness, and you kind of mentioned something that I really want to have a discussion about, how it is taboo in our community. Why do you think that is?
Well, depending on how much time we have. I was honored to be able to speak over here at the Civil Rights Museum last year for men's health. And I prayed about what to talk about. So I'm at a Civil Rights Museum, and I felt like history is important. For everything that we have in the present, history is important. And I really hated history coming up. But the older I get, I realize that you don't know where you're going if you don't know where you've been.
Right.
So the Tuskegee Institute, there was a big, major series of events that happened back in the 1940s where our people, blacks, were presented this offer to be able to undergo this study on syphilis. And they were told that they would get free tuition, they would get all these different perks, but it was going to be a 6-month study where they studied this particular condition. Well, instead of it lasting 6 months, it lasted, I think, over 30, 40 years where our people were intentionally given syphilis. And we watched and saw how syphilis deteriorated. We saw that it affected eyes. I mean, we usually use black people as guinea pigs to see what would happen if you do not treat it. So that's what we learned about secondary syphilis that can affect your hands and skins. We learned tertiary syphilis. And we actually had mothers who were pregnant, who gave birth to children with congenital syphilis, and they were born with heart disorders and conditions, and they was dying right there on the spot. So think about all of this time that happened between the 1940s and up until the 1960s, where the government, where our nation knew what was going on.
Absolutely.
And we didn't, it was accepted. It was okay. The whistleblower said something, I think, in the 1960s, and it was the Clinton administration that was like 20 years later who eventually acknowledged and actually made an apology. But that was very traumatic. And I think that shed a very, very nasty, a very, very dark moment in history that has kind of passed down from generation to generation, where black people do not trust physicians, first of all, but they also have post-traumatic stress, post-traumatic slavery disorder, where this is all mental health. So there's trust issues. There's the fear of, if I do acknowledge that I have a problem, can I trust that there's a system out there that's going to protect me and not embarrass me? Is there a system out there that's going to actually comfort me and not make me feel like, I'm the problem, not make me feel like I'm the victim?
And also make you feel like you're a priority.
Right. So I think that's a lot of it. I mean, I have patients who have only, 6th grade educations, and I have patients who have medical degrees and lawyer degrees who all deal with the same problem. And a lot of them deal with the defense mechanisms, which we subconsciously use to try to still cope as far as denial. A lot of people are familiar with denial. So instead of acknowledging that they have a problem, they say, no, I don't have a problem. A lot of people deal with displacement. So they have a bad day at work, they go home, and they kick the dog or to take it out on a spouse.
Or start to self-medicate or in other ways, other unhealthy ways.
Right, whether it's drugs or whether it's going down to Vicksburg and gambling, or whether it's drinking.
Whatever it is, yeah.
Right. And they think that this is the way of life, but in reality, no. There actually are healthy coping mechanisms, whether it's therapy, whether it's yoga, whether it's singing, whether it's spiritual therapy. There's healthy coping mechanisms. And interestingly, once patients are awarded the opportunity and they're exposed and empowered to be open to trying a lot of those things, they get better. We do yoga upstairs with my wife's nonprofit.
Right.
And I had a patient who blessed me so, Chandra. She apparently went, and I didn't even know she went to yoga, but she told the yoga instructor, Dr. Turner told me that he was not going to give me Xanax like I wanted, and that he was prescribing yoga, and I was not to ask for any more medications until I worked on some natural ways to be healed. And she went and did something.
Yeah. And I'm going to tell you, years ago, I had this experience where I was in church, and I think this was probably even before we had the North location. And I noticed like my heart started beating really fast. And
palpitations.
So, right. And so
that word.
It didn't feel like heart attack or anything, but it was just there, and I couldn't figure out what it was. So it got worse. It kept going. And so after church was over, I really felt like I needed to go to the ER. So I went to the ER.
Wow.
And the doctor, they did everything they were supposed to do, because when they hear that word heart,
right.
So they go into mode, EKG, everything else, all of those tests came back fine,
Yes,
so the doctor came in there and he literally had two things. He said, I can give you this pill. It was kind of like on what's that, the red pill or the blue?
Right.
He said, I can give you this pill. I can give you this prescription. He said, this is also a book. He said, because what you're having is anxiety attack.
Wow.
And so that he had a really long conversation with me. Wasn't a doctor that I knew. Wasn't even a black doctor. But he recognized that just giving me this pill, just giving me this prescription wasn't going to fix whatever the bigger issue was. Right. And so I'm so great. I don't even remember his name,
He was an angel.
Yeah, but just that moment really let me know, because there was some things going on in my life.
Right.
Some things that I was dealing with, a whole lot of stuff that I was dealing with at that time. Had just lost my grandmother, had just lost my father. Then a month after my father, his mother passed.
Wow.
And, so it was a lot of things just on top of each other.
Wow.
So I understand the necessity and of having a physician that will be able to say to you, this pill won't just fix it.
Right.
Yeah.
Right. And I want the people to understand this. According to the studies, about half of Americans will experience some type of mental condition in their lifetime. Mm-hmm. That's a lot. Every other person. Studies also show that by the age of 14, about 50% of people have experienced a mental health condition. Mm-hmm. And by the time they're 24, 75%. Now, I had my own experience with dealing with rejection of my biological father, and I didn't even realize I was dealing with it. And I was acting out in school. I always made good grades, but in my teenage years, my parents just thought I was feeling myself and smelling myself.
Yeah.
But I was acting out and getting in trouble and, just doing a whole lot of things that I didn't realize. And it wasn't until I got in my 20s and I started being in medical school that I realized that I was suffering from a mental health condition. I was dealing with repression, dealing with rejection. So with repression, I was suppressing the thoughts. So I didn't have to deal with the disappointment of my biological father not being present in my life because I suppressed it. So I put it out of my conscious. So a lot of people don't realize that we made up out of a conscious and a subconscious and an unconscious. So until we address the underlying issue, we don't fix it. And then what happens? A lot of times we pass it down from generation to generation
Absolutely.
to generation. And, a child can watch their father abuse their mom and think as a child would never do that. And then they get older and they get into a big argument and they don't realize that, wow, I'm doing the same thing that my daddy did.
Mm-hmm.
Yeah. So it's real.
It is.
I mean, we're seeing more and more suicide, more and more depression. It's happening in younger children.
Yeah.
I mean, this thing is really, really serious. And I just want us to be intentional.
Absolutely.
And not being afraid of the unknown. And that's a lot of it. A lot of us are fearful of what will happen once I acknowledge that I have a problem. But you cannot address what you continue to suppress.
Right.
And until you confess, you'll never have progress.
Absolutely. So guys, we really just want to start this conversation and kind of take away the stigma. Because it's so much that can go into that. Even we talked about grief,
Right.
all of that, just stages
Right.
of life. And that's another thing. Like the older we get,
Right.
we understand when you see teenagers go through puberty and go all of that. So we understand that transition of life.
Right.
But as we get older, there are more transitions that happen.
Yes.
Yes. And I don't think we talk about those enough because as you get to that certain age, your parents and life changes and everything else. And so always just needing that healthy outlet, that healthy coping mechanism. So talk to us a little bit right now about some of those good coping mechanisms and even some resources that you may want to share.
Right. So let's talk about that because there's a lot of options that's out there besides unhealthy coping mechanisms as far as smoking, as far as drinking, as far as things that you end up robbing Peter to pay Paul.
Absolutely.
So there are some questionnaires that actually kind of lets you know because people, listen right now are probably thinking, well, how do I know if I have depression?
Mm-hmm.
How do I know if I have anxiety? But there's some questionnaires that we're going to discuss to help you kind of figure out that. So depression, although you may not feel depressed, you may have noticed that you have a change in your sleep pattern. So either you're sleeping a whole lot more or you're not sleeping at all. Your appetite has changed. You don't have much energy. So do understand that there are some questionnaires that all you have to do is go to Google and look up depression questionnaire. And if you make a certain score on that, it tells you whether or not you have depression, same for anxiety. Mm-hmm. Based upon those answers, you're going to see it say whether or not you may benefit from therapy versus medications. Mm-hmm. Let's talk about medications first. That's easy. So anytime you have any type of mental health condition, you have a chemical imbalance in your brain with all of these neurohormones, serotonin, dopamine, norepinephrine, that get off balance. And if the condition is severe enough, it takes medications to get those back in check. And that's important because in the spiritual community, a lot of times we just say, well, doc, I'm good. I don't need to see a psychiatrist. I'm just going to pray about it. God got me. And God does have you, but God also provided doctors. He provided therapists. He provided medications. All right. So with that being said, there is a place for medications, but that will be at the discretion of your physician or your provider if you need those. Just because you get started on those, listen to me well, just because you get started on those does not mean you have to stay on those. But there is a period of time where the chemical imbalance needs to be in harmony, needs to be back stable. All right. So in addition to medication management, there's also behavior health therapy. So you can actually go and see a psychologist who will discuss with you different ways to be able to know how to cope when you get that emotion of feeling sad when you're by yourself and you maybe be tempted to watch Lifetime and a host of ice cream. That emotion, they talk to you right then about
what is Lifetime, Justin. No, I'm joking. Keep going.
Well, look, I had to be careful because I watch Lifetime sometime, and it pours at you. I mean, it's deep stuff right there.
Yeah, it was just funny. Go ahead.
Right. So the therapist, I don't want people to keep underestimating the power of therapy. I had 2 patients this week who had 2 people that they've lost that they're trying to adjust, and they told me, I'll be all right. I just need some time, and it hurts me because those same persons come back months later and they're telling me I need some time off my job. I need this. My family is falling apart. My marriage is falling apart. And it's like, doc, I didn't know I needed it then, but therapy is powerful, guys. Yeah. And the way I want people to think about it is, what risks do you take getting therapy? Is there a huge risk if you actually went and agreed to get therapy?
What's the worst they could have?
Right. So think about that. So that's one option. And a therapist will discuss different ways to know how to cope. But there's also yoga, which is something that I did not know about coming up, and I didn't realize the power of it, but I've been doing it. Like I said, I have my own issues. We all have issues. We all put our pants leg on one at a time every morning.
Absolutely.
But yoga has been helping me with being able to manage stress. We're all going to have stress in life, and it's not what happens to you in life, it's how you respond.
Absolutely.
All right?
Absolutely.
So yoga is an option. Meditation is an option. Spending some quiet time. We are so busy nowadays.
Just slowing that mind down.
Slowing the mind down. Just spending 10 or 15 times of quiet time. No social media, no TV, no radio, no children, no wife. Get up just 15 minutes early and spend some time alone just meditating on thoughts and positive things. As a person, think of so is he or so is she. Like those things are very, very important. So meditation, listen to candles, listen to uplifting music, going to the reservoir and having some quiet time, reading a book. So there's plenty of healthy coping mechanisms that will help you get through.
Right. But and more than anything, I think what I would love for people to take away from our conversation is that it doesn't mean that something is wrong with you if you need to go and see a doctor, if you need to go and see a counselor, see a therapist. And also at the same time, know that help is available. You know, you can live a full and rich life. Help is available. And even if it's someone that you love that may be dealing with those issues, you know, you may need coping mechanisms for being a caregiver or a spouse or a family member or a friend of someone that's dealing with those issues.
Yeah, so caregiver strain is actually a real condition.
Oh, yeah.
We can't bill for it, but it is real. And if you hadn't dealt with it, then keep living because you will. Because the way that life happens, you know, death is inevitable, and there's going to be people that's close to you that's not going to be here. And I had a patient past week as well. She last saw me over a year ago, and she had diabetes and we was working on getting it better. But she's been gone for a whole year and a half. She hadn't had medications. She just told me, "Hey, doc, I have not been taking care of myself." My sister had pancreatic cancer, and it was just really, really tough, and I had a hard time adjusting. I'm doing better now, and I'm back now, and I'm ready to get my life back on track. You know, so understand that if you are taking care of someone else, like my good friend Chandra told me a long time ago, and I never forget it, you cannot pour from an empty cup.
All right, guys, listen, this conversation, we could go on and on and on, but Justin has to get back to work, first of all, because he works so hard. But we're so glad. Thank you so much, Justin. Give everybody all your information, social media info if they want to. Even I'm pretty sure follow you online and keep up.
Follow. Yeah, please follow because we leave a lot of information on there, and I go live and have free question and answer sessions. I just want everybody to be educated. I probably should have stopped taking new patients, but if I feel like if I do that, I'm going to limit my reach. So follow us on Instagram at Turner Care MS. So TURNERCAREMS. That's on Instagram. And then on Facebook, we also have a Turner Care page as well. I have a personal page. I'm maxed out on friends, but you still can follow me on there. Because like I said, there's plenty of information on there as well. The office location is 2135 Henry Hill Drive, Jackson, Mississippi. Turner Care. Phone number is 601-398-2335.
Yeah. And so we're going to have you back. And also, you're a beautiful wife at a certain point. She has an amazing foundation that she was supposed to come and do an interview, and then she got under the weather and the babies and everything else. But we're definitely going to have you back so that you guys can talk to us about some of those same efforts you mentioned. All right.
Yeah, we're looking forward to it. So y'all stay tuned, and we have a whole lot more to do.
That's right. Thank you so much, Justin. We really appreciate it.
Thank you.
Thank you guys so much for checking out this week's conversation. A very special thank you to my guest, Dr. Justin Turner. Guys, let us remember to keep having this conversation about mental health and making it a priority and continuing to do what we can to end the stigma. Continue to follow online on Instagram and on Twitter at Chandra Wise, and make sure to like the Inspirational Power Hour fan page on Facebook. Thank you so much for checking out this week's episode. Stay focused, stay encouraged, and stay safe, and I will see you next time.
It's the Inspirational Power